Hi, my name is Randy. I interviewed Megan Bilbo. She is a nurse informatics nurse over at Loma Linda. She has been there for quite some time, and she has her bachelor's in nursing, and she had told me that she kind of stumbled into the role as a nurse informatics nurse. She was in this unique position where they needed a nurse informatics nurse because they were switching from paper data to normal, like what we call normal, at least nowadays, like electronic medical records. So they needed somebody to be able to help bridge that gap and to help train other people in order to really succeed in this new technology. So they had picked her, and she went through extensive trainings in order to become the nurse informatics that she is today. Overall, though, throughout my interview, I learned that being a nurse informatics nurse is very, very crucial in healthcare, particularly in the realm of patient care and safety. Because the nurse informatics role, it's not just about technology. It's about finding those dots that connect in order to help protect clients and to find these connections to help prevent a patient from declining or getting worse. And additionally, I've learned about the challenges too that nursing informatics has to face, especially because once you kind of get used to something, change is hard. So for Megan, for example, she went from having to do paper data to online, and that was a huge transition. And she said that one of her challenges was being able to get all the nurses on board, trying to teach these nurses, hey, I know you really like the paper data, but I promise you, like, this is going to be easier, and this is going to benefit you and the patient. That's the most important. It's going to benefit the patient and their safety. So being able to really do that and to help try and convince others that this is important and why it's important is huge. So some of the questions that I asked Megan include describing that career path. So she, like I said, she kind of just got chosen to be in that path, and she says she loves it. She wouldn't change anything about it. So she really does do all the analytical side of things, but she knows what she's doing is important and does end up helping the patients in the long run. So discussing the value of informatics as a driving force of nursing care at her facility. So like I said, she works at Loma Linda. So she says that the value of informatics, it depends on what you want to extract from it. Because in informatics, you have all the data. So it really depends on what you want to make of it. So she told me that what she really looks for is connecting all the dots, trying to find X, Y, and Z in a lot of different people that then lead to sepsis, for example. So then that way they can make protocols that say, hey, and flag it. So that, hey, if your patient has X, Y, Z, here's a flag saying that, your patient might have this or is eligible for this. So you might want to, as the nurse, keep an eye out, really look out for these things to help make your patient safe and to prevent any further decline in your patient. So safeguards and decision makings, she had stated, are all done by stakeholders, shareholders, and the executives in the company. So what they do is they have a collaboration between the front end team and the people who build the program. And they all communicate, but they have this super user meeting that happens once a month where they discuss, hey, what do we need to do to better our patient care? What's going on that we can do better? What was our goal for last month? Did we meet that goal? Why or why not? If we didn't meet it, what can we do this month to help achieve that? So I think that's really important, and I didn't realize that they met that often because patient safety is crucial, and we want our patients to have the best experience and to be able to leave the hospital and go see their families and go on about life the way that they want to. So I think that being able to meet up every month and saying, hey, what are we doing wrong? Why is it going wrong? What can we do to change it? Is very good, very insightful, because then it really puts into perspective that on the back end, because as a nurse, like I don't see that. So it's nice to know that they're also continuously working hard to help our patients be able to go home. So I thought that was really interesting. So another question was, tell me about patient care technologies that have improved in your patient care facility. It's all the safeguarding. So as everyone probably says, like the sepsis protocol is huge. That's one of the safeguards. So being able to have, she stated that like, being able to have that really is important. And they're trying to find other disease processes or infections or respiratory trauma that they might be able to connect and other types of dots to then look for in the future, so that way they can make another safeguard protocol, so that way we can continue to help keep our patients safe. So what groups of healthcare workers rely on her to collect that data and data quality information? Like I mentioned earlier, really like the stakeholders and the executives of the company, because they're the ones who really go over all that data and they ultimately make the decision. She actually doesn't make any decisions about the information provided, which I also thought was interesting, because as a informatics nurse, I thought that would be her job or part of the job. And although it is, she can make suggestions, it's ultimately not her decision. And I find that interesting, because if these administrators or stakeholders or executives are not always in the front line to see what's going on, how are they able to make these types of decisions? Which is interesting to me. I just thought that was a very different way of doing things. I thought, the people who were there and being able to kind of see the data and who'd also been in that clinical setting before should also be a part of that decision-making process. Loma Linda is a magnet hospital, and they are currently keeping up their credentials in order to stay a magnet hospital. She stated also that working with IT, they don't really work much with IT, which also surprised me. I thought as a informatics nurse that they would be IT and they would also do like the data analytics side. But she said that they only talk to IT really when they need them, if something really breaks. And I was like, oh, I thought that was like very interesting. I thought they would talk to them more than that. But they don't. So my last question that I had asked her, that was my own question, was if she can share an example of how the implementation of a new technology or system improved patient outcomes or workflow efficiency. And she said the largest impact was for safety and quality, like again, those safety protocols, because she was in this unique position where she was in the paper nursing realm to now this technology realm. So she was able to see the big difference and the impact between having paper data versus electronic data. So she was in this unique position where she was able to see like, we can connect these dots now. We can see that if people have these precursors, they're most likely to have this, and we should treat them for this if they have these precursors. So being able to have those safeguards and those protocols up, she said, has made a tremendous difference in the nursing realm and life. And it was very, very important that that had happened. So that's really it. Like I said, again, her challenges were really being able to get other nurses on board with being online rather than paper, and change is hard. So she was really flexible and understanding about change, and she worked with people individually in order to help them improve themselves. But I found my interview very interesting with Megan. I really enjoyed her time in her company. We had spoken over the phone, and it had made me really think about being an informatics nurse, and I'm very interested to learn more about it.